Thank you very well, thank you.
Now, this month is the 40th anniversary of the first ever baby born from IVF treatment, 40 years on, and with technology advancing every day. Is this a good thing, or could couples be conned by money-making companies?
Well, it is something Professor Robert Winston, who is Britain's best-known reproductive expert, he's been investigating, and he joins us now, and it's always lovely to welcome you onto the show. So, 40 years since the birth of Louise Brown, first IVF baby, as we said there, and you say, actually, this is a time, really, for reflection.
Yes, it is, I think. Of course, congratulations to achieving the first baby, but I think it's really very sad that the success rate is as unsuccessful as it is.
Right.
Only about 1 in 4 cycles of treatment actually result in a live birth. Yeah. And the majority of people over the age of 35, it's less than that. And, of course, most people are over 35 when they go for IVF. So there's a lot to be done, and the problem really is that there's not enough research going on.
I remember you said here some years ago that you were peddling in disappointment.
I think I said, Philip, peddling in failure.
Right.
And I have always been haunted by that, actually. And I think we probably should be haunted by that a bit, because, of course, the desperation of people who go through this treatment is much greater than they ever really express, generally speaking. And, of course, they often pay large sums of money. They often have treatments which aren't properly validated, and much of the time they're going to be empty-handed. And sometimes they'll have a miscarriage, not infrequently, especially if you're older. And I represent a thing called the Genesis Research Trust, which is an organisation which is purely trying to improve IVF. One of our goals is to improve IVF, as we have done in the past, by trying to promote more research. But it's difficult to do research at the moment because of the private market, which actually is on the whole really much more interested in treating people rather than understanding the cause of the infertility.
And the reason for the more interest in treating people is because there's a lot of money being made out of these private clinics.
Regrettably, there is a lot of money to be made. Nobody minds private practice, I don't think, in this day and age. But sometimes people are being exploited. Of course, there are some very, very good people out there.
Yeah.
But there's also a lot of malpractice as well, which gets away in spite of the regulatory authorities.
And there's also a lot of people that are being pushed to go abroad because of how expensive it is here, and that brings with it a different set of problems.
It's not a vast number that go abroad, but the problem with people going abroad, of course, is they get treatments which are unvalidated, which may be, in fact, quite dangerous and costly. They may come back to the border control with more than 1 embryo or 2 embryos in their uterus because, of course, they're free of the restrictions that we impose, so the chance of a multiple birth is higher and the cost to the NHS is greater. So there are some real difficulties there, and sometimes they miscarry, of course.
Yeah.
So at their most vulnerable time, because we've met people, and obviously this is where you work, people who are so desperate, it is all they want. Are they in danger of being ripped off?
Well, I don't want to use, terribly pejorative language, but the basic problem is that people now think that in vitro fertilization is the treatment for infertility. And if I went to the doctor with pain in the chest and asked for open heart surgery, he would laugh at me. I might have a broken rib, I might have bronchitis, I might have indigestion. But if you're infertile, a different symptom, you get IVF, even though that may not be the best treatment. So the first thing is to make a diagnosis. And on the whole, the private clinics are not doing that well. In fact, if you look at the HFEA's own figures, the regulatory body, they show that 40% of people going through IVF have unexplained infertility. That's, inverted commas, a diagnosis. It means they haven't made a diagnosis because it's unexplained.
So is it just that there's not enough information then for those out there wanting to seek it?
I fear that's true, and that's one of the reasons why the Trust, the Genesis Research Trust, puts out on its website as much information as it can do, which is completely unbiased and free of charge.
And obviously, of course, you said a lot of this is down to where you are. This is a postcode lottery.
Yes, about 40% of some treatments will get NHS funding, but it does depend where you are, and sometimes it's limited to 1 cycle, which is very, very unfair because, of course, if there's only a 25% chance per cycle, the treatment needs to be repeated. So it's like stopping the treatment halfway through. Yeah. Imagine having cancer and only getting 1/3 of the treatment, and then saying the drugs are too expensive, we can't continue. That happens to infertile patients, and they don't complain.
Well, thank you very much indeed. I know that you're going to stay kind with your time today, Lord Winston. You're going to stay for our phone a little bit.
Yes. Yes, I hope we can shed some light.
Yeah, that would be really good. All right, thank you very much. We'll see you back here in just a moment.
Right, still to come.